Hello everyone, welcome to sqadia.com, and let's start with our section 3 of malignant disease of the ovary. In this section we will talk about the peritoneal carcinoma and epithelial tumor, and we will talk mainly about the primary peritoneal carcinoma and what's the FIGO staging for peritoneal carcinoma. So primary peritoneal carcinoma is usually a high-grade pelvic serous carcinoma, and then it's papillary serous carcinoma of the peritoneum. So two types mainly. One is high-grade pelvic serous carcinoma and the other papillary serous carcinoma of the peritoneum. Peritoneum is the covering that covers the abdomen, and all the abdominal structures are present inside the peritoneum. So it's the covering of the abdominal structures. What's the criteria for the diagnosis of the peritoneal carcinoma? In this ovaries are either absent or normal in size. Usually the ovaries have no problem. Size is normal, usually less than 4 centimeter in diameter, or they are already removed or absent. There are extra ovarian sites are more involved in this. So ovaries are not mainly involved. Extra ovarian sites other than the ovaries are involved. So again, size of the ovaries is less than 4 centimeter. And then histology is again mainly if you examine the under the microscope, the histological and cytological features of this tumor, usually it's serous type. In this serous type, there is usually presence of the clear fluid is mainly present. So serous type. In this primary peritoneal carcinoma, the staging, same pattern of staging is involved as for the ovarian cancer. And then management is again according to ovarian carcinoma grading and staging. Prognosis is again also poor like the ovarian cancer. Ovaries are normal or slightly bulky or more extra ovarian disease than ovarian, and low volume peritoneal. So in this mainly the ovaries are not involved. They can be slightly bulky. Size of the ovaries is usually normal, less than 4 centimeter diameter, and extra ovarian structures are mainly involved, and it's of serous type. Serous type, clear fluid is present. The epithelial tumor can be benign, malignant, or borderline. Benign are more or less localized, non-metastatic. They cannot spread or they do not spread. Malignant are the tumors that spread beyond the area of the involvement and metastasize to different areas. So malignant, and then in between benign and malignant, they can be sometime borderline. So maybe more or less localized or very little spread in borderline cases. Mostly they are serous, contain clear fluid, bilateral, and they are present around the age of menopause. The other type can be mucinous, then endometrioid, clear cell, and Brenner type. So epithelial tumors can be benign, malignant, borderline, and mostly they are serous, and some of them can be endometrioid, mucinous, clear cell, and the Brenner type. And the epithelial tumors, mostly they are ovarian cyst, serous cyst adenoma. Cyst are the round structures, fluid-filled cavities which are filled with the serous fluid, or they may be mucinous borderline tumor. In the border means they are present between the benign and malignant, and they are mainly mucinous type. Mucinous are the thick mucus type secretions. They are not serous, clear, thin. They are thick mucinous secretions. And you can see in these histological pictures the difference between one is small cells, and the other the glands are very big. These glands are enlarged, and you can see the mucinous secretions inside. So that was about the primary peritoneal carcinoma and the epithelial tumor. Thank you for watching sqadia.com.